He can overnight oats or chia seeds and berries, or otherwise he can take fruits also, which normally I am saying. That way also we can go. Mild moderate snacks, small apple or a tablespoon almond butter. Lunch, quinoa salad or mixed vegetable omelette. Only simple food. We should restrict all carbohydrate diets. Huh? Afternoon carrot sticks, hummus. It already carrot. We cook more and eat like that. Then in dinner, tofu or broccoli or brown rice like that. And evening, if is needed, then you can take yogurt, unsweetened yogurt. Hmm? Paste. We make the paste. Paste. Other meal plan is see. Otherwise, you can take smoothie with spinach, unsweetened almond milk of half banana. In morning, we can take handfuls of nuts, unsalted. Huh? Other pattern, other diet you can follow. In lunch, lentil soup with a mixed salad or green cucumber or tomato olive oil. You can take cold press oil also. Then in snack, you can take drumstick also, that this also, and peanut butter. And in dinner, grilled vegetable kebab or quinoa seeds, and evening small berries. In stage 3, see, sugar above 180, limit carbohydrate diet, limit, spiking the sugar can increase. Focus on low calorie, nutrient based foods, and regularize the sugar levels. What is the simple plan? See, diet. Chia pudding made of unsweetening, all sweeteners should be avoided. In that morning you can cucumber slice, or you can grate the salad, so you can take in the morning also. Sprinkle mild salt. Salad before lunch or during the lunch also you can take. Mix with greens, vegetable, chick seeds, cherry tomatoes, and then snacks मध्ये snacks unsweet yogurt sprinkle with cinnamon. When we eat this na, what dairy foods na, dahi or tak, whatever you eat, yogurt, you should eat before meal, before whole meal. Dairy foods always before meals. And even the milk and the other dairy foods we should avoid. Compulsory we should avoid. They increase fats in the pancreas and liver tissue because of sugar rises. In juvenile diabetes also, because of drinking more and more milk in early phase outside milk, the juvenile diabetes happens. And in the dinner, steamed vegetable like broccoli, carrot, how much you reduce the consumption of carbohydrate now, that is very important. Okay, thank you. These are the common metabolic disorder and its common basic diet. In metabolic disorder, diabetes come. Type 1 autoimmune condition where body does not produce insulin. Type 2, the condition characterized by insulin resistance and often associated with obesity or fatty liver. This is a common cause. Metabolic syndrome, the cluster of the condition that increase the risk of heart disease, strokes, diabetes, including high blood pressure, high sugar, excess. These are the syndrome which any of the condition can arise in the body. This is the metabolic syndrome. Okay. Next is obesity. It also comes. These are the basic excess body fat that can increase a various health issue, including diabetes, heart disease, certain cancers, dyslipidemia, abnormal levels of lipid. I have seen the patient, the triglyceride levels are more than 4,000 triglyceride level. All the blood they take out na, and centrifuge na, the whole blood is looking like white color blood. More than 4,000. The case is on Facebook. Now you can see more than 4,000. And treated by homeopathic medicine, the icobodium, in 1 or 1.5 months, it came to 700. With obesity, with diabetes, those patients are having more pancreatic symptoms. When we see such as a high triglyceride level, na, and in blood test also, when we see lipid profile, na, those patients are suffering with high triglyceride level in future or in pre test we do na, they are prone to more diabetic patients. So we have to reduce triglyceride, we have to reduce the diet also. Huh? Abnormal level of lipid fats in the blood, including high cholesterol and high triglyceride level. This goes to obesity or diabetes also. Hypothyroidism, the condition where the thyroid gland does not produce enough thyroid hormones and lead to the slow metabolism in the body. Okay, these are the other also. Hyperthyroidism, overproduction of thyroid hormone resulting acceleration of metabolism, they become very thin. Gout, the form of the arthritis that cause high levels of uric acid in the blood, leading to the formation of crystals in joints. This also with kidney disease or any other heart disease it comes into play. Inherent metabolic disorder like phenylketonuria or galactosemia will result from defect in genetic defect affecting metabolism. This is the rare cases. What are the common symptoms? This is the common symptom we can see. And these are also mentioned in the chronic disease Sura part also. Fatigue, they say generally I feel fatigue, unexplained weight gain or weight loss, unknown thirst, increased thirst and hungry, urination, frequent urination, night urination is there, muscle weakness came, joint weakness come in gout, and skin changes or because of insulin resistance the neck regions or any other skin parts become dark color, dark changes come. These are the signs of metabolic disease coming in the body. What are the food we should eat to avoid the metabolic disorder? See, focus more on fruits and vegetables, non-starchy food, green leafy vegetables, spinach, kale, broccoli, bell pepper, fruits, berries, apple, pears, or lowering the sugar, low in sugar and high in fibers. Whole grain diet, grain food, quinoa, high protein fibers and proteins and fiber based on salad. Salad should be more. Brown rice you can use. Then oats for a breakfast, which are high soluble fibers and control the blood sugar also. In legumes, lentils of high proteins and fibers, maintaining the weight management properly. Chickpeas, versatile of salad. We can make any types of salad, soup or hummus. Black beans, rich in antioxidants and proteins, which is necessary. Healthy fats, that is cold press oil from the nuts and seeds also you can take. Or the avocado, the monosaturated fat, we can improve the heart conditions also. And dairy alternative, you can avoid the dairy foods, you can take plant-based milk, almond, soya or oats or non-sweetening items or yogurts which are high in proteins and low sugar in variety. Okay, this is the basic metabolic disease and diet. Thank you.
What about curd and buttermilk?
You should take before meal, not during the food. Some people they take milk during food also. As we use salt in the milk, they both are opposite. So every other milk product you eat, any other you eat before food, half an hour before. But in that also you should not eat salty material. Otherwise, again the metabolism get disturbed. Either you can come with a disease, skin disease, urticaria, rash, or eczema. All those conditions come by opposite food may be eating. Regarding PET scan, I will also PET scan for cancer patients, how to diagnose. PET is Positron Emission Tomography. How PET scan works, PET CT. The principle of PET scan is the PET involve injections of radioactive tracers, commonly fluorodeoxyglucose, they inject in the blood veins, which is a glucose analog. The cancer cells and other metabolically active cell absorb this all and is a tracer for the normal tissue. The imaging is done in short period. The patient is scanned and the scanner detected by the gamma rays emitted by the tracer, and they show where is the high metabolic activity seen in the cancer tissue, and according to that they measure what is the value in that area. where it is applicable, we can, this is a non-invasive cancer test detection. We do not have to do biopsy. In cancer detection, helps in detecting the cancerous tumors and assessing the metabolic activity, how much the metabolic activity is in cancer cells. Okay, and from staging also, the extent of the cancer spread, where the cancer has spread, metastasis happen, and for evaluation also, how much the metabolic activity has changed. It can also detect early cancer before actual cancer detects. Cancers come into the pathology. And metabolic activity seen in the anatomical area or any other small lymph node area, they can detect also.
Sir, can you please elaborate on the evaluation part? So we have a patient, we have a pre-scan, and after we give medicines, after 6 months we take PET scan again. And would we compare based on the darkness of the area?
Based on how much glucose metabolic activity is increased in this area.
Okay. They will give that.
They give the number. SUV standard update value. On that value we can base. How much value is lower, that much cancer activity is low. And if there is only glucose intake is there, but no activity, then you can say cancer is not there.
It's too costly, no sir. It's about 25,000.
13,000, 10,000.
No, in Kerala,
30. In our area, it is I think 13 or 10,000 they take. Mahatma Phule Trust, they are doing all the stamp. In that they take 8,000 also. Minimum value is 8,000, maximum more than they can take anything. But in our 8,000 to 15,000 rate is there, PET scan. But only we have to do after 6 months. It is very easy to know where are the traces of cancer. Otherwise, by physical symptom we cannot know also. And no other way to detect the cancer in the other part. And if already metastasis also we can search also. And when metastasis actually come now, already he has spread in various parts of the body. We can control by this also. No? And according to the treatment we can consider. And how to measure it? They have given SUV max, they write in the this one, PET scan report. Standardized uptake of maximum value is a quantitative measure used in a PET scan to assess the metabolic activity in the tissue, particularly in the context of the cancer diagnosis and monitoring the treatment monitoring. What is SUV max? The definition is the high standardized uptake value measured in the defined region interest of ROI and PET scan. It reflects the maximum concentration of radioactive pressure, usually FDG, fluorodexaglucose in that region. The calculation is dividing the radioactive concentration in that tissue. They inject these injections and they see the metabolic and measure that. The tumor metabolism, how they decide? Higher the metabolic activity, higher the malignancy rate. How much the higher? Usually, if it is below the 2, 3, don't need to worry. Normally we can control also. If the values are more than 10, more than 15, more than 25, more than 35, then the cancer is very dangerous. By that also we can judge.